Hi, my name is Araceli Rodriguez. I'm a licensed clinical social worker. I've been a therapist for Kaiser Permanente for about 8 years now. I've been both inpatient and outpatient, so when somebody comes into the hospital and when they get released from the hospital as well. I also do have my private practice where I do currently provide individual counseling for patients. What I'm going to be talking to you guys about is coping and communication when it comes to cancer diagnosis. So, uh, what I'm going to go over is how do you talk to somebody who has been diagnosed with cancer, and how do you talk to somebody who has a loved one that has been diagnosed with cancer? Both experience different things, but the emotions, the feelings are very, very similar. So, the reason why I'm talking about this is I have my own personal experience with cancer. I had three loved ones diagnosed with cancer, and out of those three experiences, I realized one thing: everybody is suffering in silence. There's somebody who's in the restroom crying by themselves, there's somebody in the bedroom. Usually, there's two people in the kitchen, two people in the living room. Everybody is talking about it, but in spurts. Nobody likes to talk about it communally. So, what happens? Everybody is suffering in silence. So, with coping and communication, I know that a lot of people don't know what to say to somebody who has been diagnosed with cancer. A lot of people don't know what to say to somebody who has a parent or a child who's been diagnosed with cancer. So, we fail to forget that everybody is struggling. Everybody has their own ways of dealing with this. So, why don't we talk about this freely if we're all feeling very uncomfortable, if we all are feeling so many emotions within us? We don't talk about it freely because no one likes to feel uncomfortable, right? Um, they feel like they have to constantly protect that person who's been diagnosed with cancer or protect the child because their parent got diagnosed with cancer. We feel like if we don't talk about it, we're protecting them. We also feel that we need to be strong for that other person, and so we don't want to bring up something that's going to make them feel uncomfortable. Everybody talks about cancer affecting your physical health, but nobody talks about cancer in the way it affects your mental well-being as well. And so when nobody ends up talking about this, we end up feeling those emotions very intensely because we have nobody to share it with. And so this only perpetuates the fact that we really are all suffering in silence because no one is talking about it freely. So, what's the first thing that happens when you hear that somebody has been diagnosed with cancer? It's very upsetting. It makes people automatically think about death. But we know this is not the case, right? A lot of people with cancer end up getting all the treatment, they end up being cancer free. But when you just hear that word, it's very, very overwhelming. And so, cancer is associated with many feelings at every different stage of the process. You and your loved ones are going to have to adjust to the different types of phases when you go through cancer at different stages as well. And so, we need to learn to adapt to the different stages. So, at the very beginning, it can be very overwhelming, right? Then, after that, you're a little bit more calm. Then you get treatment, then you're having to go through the whole struggles that comes with the treatment. So at every different stage, there's different emotions that are going to come up, and that's okay. So coping with the diagnosis is there are many, many emotions that go through your own head or through the head of your spouse or through your child. There's so many things that are going on at the exact same time. And so a lot of the times when we hear the word cancer and someone has been diagnosed with cancer, whether it's yourself or whether it's a family member, we have so many emotions. We don't know what to do with them, especially because we're not talking about it with anybody. And so, a lot of the times, it's a lot of anger and frustration. And we end up taking it out on those that we love the most. We take out our anger and we take out our frustration to those that we love the most. Why do we do that? We feel safe around them. We know if we behave badly, we know that they're still going to be there to support us and help us and be with us through that journey. The projection of this is that a lot of the anger and frustration, it stems from a lot of the feeling of what cancer brings up as far as the feelings of loss. And so expressing that is very, very difficult. To share the fact that you're very fearful of someone passing away, of seeing them suffer, is very overwhelming. And so it's very difficult to put that into words. And so we typically just lash out by being angry and by not wanting to associate, not wanting to do anything with them because we don't want to have to deal with that. So we end up taking a lot of the anger on those that we do love. A lot of the things that come up as well for when someone has been diagnosed with cancer or your loved one has been diagnosed with cancer is fear and anxiety. These are some of the emotions that no one wants to admit, but it's the very first emotions that come up for us when we hear the word that they've been diagnosed. It's a very uncertain time for everybody, right? There's fears about changes that come with money and job changes, body image, personal relationships, and a lot of the times that transpires into, anxiety, and it comes across as them acting distant. So I remember there was somebody who was diagnosed, right, with cancer, and I was very distant because I was just very fearful of, I don't want to get too attached because I felt that, cancer was going to take away their life. And so I felt like I was protecting myself by distancing myself with them. That's not the case right now. They're very healthy, living life, but since I didn't have anybody to talk about this with, I didn't have anybody that I wanted to share this with, I didn't know how to deal with my own emotions. A lot of the times for children, they end up picking fights with that person who's been diagnosed with cancer because, again, they don't know how to deal with all these emotions that are coming up for them. What ends up happening too is we end up having this blame game. So you end up blaming yourself for what you did or you did not do. I should have exercised more. I should have eaten more fruits. I should have eaten more vegetables. You end up kind of trying to shift the blame towards everybody or anything. And also, too, there's a lot of guilt feelings as far as when you have somebody who's been diagnosed with cancer. You feel like, I can't do anything to take away their suffering. I can't do anything to help them. I feel so guilty because I can't do anything for them. Imagine how that spouse is feeling knowing that they can't do anything for you to be able to take that away from you. It's very, very difficult. And so when you're feeling the anxiety, when you're feeling the frustration, when you're feeling the anger, there's different ways that you can respond to this, right? So if a child is feeling angry, frustrated, sadness, all these things, there's a lot of things that we can do. If that child is acting very distant, like I said, like in one of the examples that I provided, if they're acting distant, if they're acting very mean, if they don't want to engage with somebody, try not to take things emotionally. It's not really you. It's just that person doesn't know how to deal with all those emotions that are stirring up inside them. All these emotions, all these things that they're projecting, it's really stemming down from fear and anxiety. And also putting an end to the blame game is the best thing that someone can do in order to move forward. If you stay stuck blaming, I should have done this, I should have done that, he should have done this, he should have done that, you're going to stay in a very negative state. By moving forward, that's going to end up helping just move along the continuum, move along the process for you. If you feel guilty, if you're the one diagnosed with cancer and you feel guilty, it's okay to feel like that, right? It's okay to express your regrets, your apologies. It's okay to feel everything that you're feeling. Just acknowledge them so you can move forward. This goes both ways for the person who's been diagnosed with cancer and for the family member who's experiencing having to witness this and see their loved one cope with cancer. Acknowledge everything that you're feeling. They're valid. They're real. That anger, that frustration, it's real. You feel it. You can't sleep at night because all these thoughts are coming in your head. Acknowledge them. Stop the blame game. Acknowledge them so we can continue to move forward. Once you acknowledge everything that you're feeling, this creates a lot more of a hopeful future for you guys. And so when you are preparing to respond and to talk to somebody who has been diagnosed with cancer or to a loved one who has a family member that has been diagnosed with cancer, be prepared to overcome the behavior, right? If they're acting distant, if they're acting angry, be prepared to overcome that and be ready to offer extra forgiveness. Is it okay that they're being extra mean to us? No. Can we understand why they're doing that, right? Because they can't express themselves fully. We understand it. So you have to be a little bit forgiving, a little bit more extra forgiving, because we don't know kind of like what they're struggling with, because they can't communicate it with us, right? If we never ask them because we don't want to make them feel uncomfortable, they're suffering. We don't know how to help them. They don't know how to communicate with us. And so it just perpetuates the cycle. So be prepared to offer extra forgiveness, be understanding, and offer that support. Think about how scared you would feel if you were in their shoes, right? If a 15-year-old has their mom diagnosed with cancer, imagine the fear and anxiety that comes with that. Imagine the spouse who has his own feelings, how he's going to manage all these, children. If you have little children, there's a lot of anxiety, and they don't want to bring it up to that person because they don't want to be responsible to be that burden or feel like they're bringing up a lot more negative emotions. Everybody has their own issues that they're dealing with. Everybody has their own set of emotions that they're dealing with, but they're dealing with it alone because they don't want to talk about it with anybody. They don't want to make you uncomfortable. They don't want to make the dad feel uncomfortable. They don't want to make your sister feel uncomfortable. So they're all suffering in silence. So how do we move forward, right? We know that if someone gets diagnosed, if I have somebody who's been diagnosed, there's a lot of things coming up for me: fear, anxiety, frustration. If you've been diagnosed, there's a lot of fear, anxiety, frustration. We can't do the blame game because it's really not going to get us anywhere. What do? What do we do in order to move forward? Okay? And I know I spoke a little bit about be prepared to be forgiving, be prepared to ask the hard questions. So when we talk about communication, the phrase that everybody always says is, how are you feeling? Right? You got diagnosed. How are you feeling? Your mom got diagnosed. How are you feeling? That's the most common question that everybody asks, but it's a very thoughtless question. And so why is it so thoughtless? How are you feeling? The response that you get from that question is, I'm feeling fine. I'm feeling good. It doesn't really tell us much, and it doesn't make us feel better that we're asking them that. And the person who got asked that doesn't feel any better as well. It's a very kind of closed off question. How are you feeling? I'm okay. Let's move forward. Let's not kind of dwell on this topic. So it's not a question that really offers a lot of response. It's not a question that offers the ability to be able to be open and honest with that person, because it's very closed off. Okay, so what is it that we need to ask instead of, how are you feeling? Okay, so instead of how are you feeling, how about you switch it to what are you feeling? With saying what are you feeling, it changes the whole dynamic of the conversation. You're digging a little bit deeper. We know that you have a lot of emotions. And so I'm literally asking you, what is it that you're feeling? Are you feeling sad? Tell me. Are you feeling frustrated? Tell me. Are you feeling angry? Tell me. Asking this helps the person feel like you really want to know what it is that they're feeling. It's a very open-ended question. What are you feeling? Okay. So when you ask, what are you feeling? Be prepared to hear the responses, right? A lot of the times, because we feel very uncomfortable, like I said, we don't want to bring up the fact that we don't want to bring up the conversation of cancer. We don't want to bring up what that's going to look like for our family dynamic. We don't want to bring anything up. And so when you switch from the how are you feeling to the what are you feeling, you're really being receptive towards hearing everything that they're wanting to say to you. So like I said, be prepared to hear anything. The person may be thinking a lot about death or worried about what the future holds for their family, right? Maybe if you're the one that got diagnosed with cancer, you fear that you're not going to be able to see your children grow up. If it's the 15-year-old who their mom got diagnosed with cancer, they fear that they're probably not going to be around for them to see their college graduation. That's a big thing for them. So be ready to really listen to what they have to say. You don't have to reply. They really don't want a response. They really want to make sure that you're there for them, so you can really listen to them. So be ready to hear the pain that they're experiencing. Be ready to hear the unpleasant thoughts that, they might be experiencing. Okay? So we just really want to make sure that we're there in the present moment for them, to be there, to offer that support, to validate how they're feeling. That goes a long way. And so when you're living with cancer, there's a lot of things that we need to do as far as adjusting our communication, right? Like I said at the very beginning, it's a long disease. There's different stages in the disease, whether it's, the treatment, or whether once you're going, you're going through chemo, you know, there's a lot of different stages when it comes to cancer. Your feelings will change throughout every stage. That's okay. We're all going through so much, and it's very difficult to be there for somebody who has been diagnosed with cancer, and it's very difficult to be there for somebody who has a loved one who has been diagnosed with cancer. We know that it's very difficult, and we know that it's very challenging, but imagine if that person didn't have someone, how much lonelier that would feel. So just even being there asking the what are you feeling goes a very, very long way. This journey is not easy. This journey is very difficult. And just by even being here, look at how resilient you are. Look at how resilient your family members are. Knowing that you've already gone through all these stages, that you've already been able to communicate, whether now, like, oh, I have not been communicating really good with my family members. Look at where you're at now. That shows so much resiliency. You have so much strength already. Switching the communication piece is only going to get you to that next level. And so one thing too about cancer is that it really teaches us about ourselves and those around us. And so with cancer and being diagnosed with cancer and having someone who's been diagnosed with cancer, remember, we all need to listen, and we all need to be able to be heard, right? The biggest communication problem is we do not listen to understand, we listen to reply. So just pay attention to how important that is. The biggest problem in communication is we don't listen to understand, we listen to respond. We want to make them feel better. We want to say, hey, it's okay. Hey, you know what? You're strong. You can kind of get through it. You can keep pushing, keep pushing, keep pushing. A lot of the times, if you're feeling sad, you just want someone to be there to hear you out. So really, the communication piece is just being there, being able to listen to what they have to say and offer that support for them. You're not going to be able to change a lot of the things that are happening. If you got diagnosed or if that parent got diagnosed, you can't take that diagnosis away from them. There's nothing that you're going to be able to do to just take it away. You're going to have to sit with them and be their support system. And so the biggest thing that I want everyone to take away from this presentation, this journey about coping and communication, is if you ask, what are you feeling at every single stage when they get diagnosed, when they're going through treatment, whether it's you yourself that's been diagnosed or your family member that's been diagnosed, remember to ask, what are you feeling? Okay? Because saying what are you feeling instead of how are you feeling can make a difference, where they can really open up to you, be open and honest. They're going to allow their vulnerabilities to be out there, and they're trusting you with their deepest, darkest emotions that they're feeling inside. So be ready to what they're going to say to you, and be ready to be there to be their support system. If you ask, what are you feeling? Think about how much closer you guys are going to get, and think about that support of what that means to them and what that means to you, knowing that you know exactly what they're feeling and you're there for them to be able to be there for them and support them. So remember, what are you feeling and not how are you feeling? Thank you.